Hi, I'm Jennifer. I'm a registered dietitian at Tri-State Memorial Hospital. I'm excited to be here to talk to you about gestational diabetes and how you can manage it with food. We're going to go over some great topics today, including what are carbohydrates, how to develop an eating pattern that is going to help keep your blood sugars in control, as well as what are some of those foods you're going to want to be eating and what are some of those foods that you're going to want to limit or avoid during this time. We'll take a look at how to keep track of serving sizes, how to read nutrition labels, and stay tuned for the very end because we're going to have some examples of some healthy balanced plates that might work for you. There are some risk factors with developing gestational diabetes. When blood glucose levels are running too high and not managed well, it can result in your baby growing too large, which can make delivery more difficult for you. There's also the risk of your baby's blood sugars getting too low during pregnancy. Having gestational diabetes can also put you at risk for developing type 2 diabetes in the future. According to the Center of Disease Control, 50% of women with gestational diabetes do go on to develop type 2 diabetes. But don't worry, we're here to give you some tips on how you can manage your diabetes through food. You want to carefully plan your meals and check your blood sugars 2 hours after eating to see if there's anything you need to change with your food selection. It's really important to get good nutrition through eating 3 balanced meals a day and then possibly adding in 2 or 3 snacks a day as well. You don't want to skip meals, and make sure you add that snack if your meals are going to be more than 4 hours apart. That is going to help to keep your blood sugar stable throughout the day and give you really good energy. Eating carbohydrate foods make your blood sugars go up. So it's important to know the types of carbohydrate foods and what are quality choices and what are not nutritionally rich choices. Foods with carbohydrates are grains and starches such as bread, crackers, cereals, pasta, rice, and other grains, starchy vegetables such as corn, green peas, potatoes, and winter squash, beans, peas, and lentils, milk and some milk substitutes, yogurt, fruit and fruit juices, sweets such as cakes, cookies, ice cream, honey, jams, and jellies, and sweet drinks such as flavored coffee, sweet tea, energy drinks, soda, or sports drinks. Foods without carbohydrates include our protein foods such as meats, poultry, eggs, fish, and seafood, cheese and cottage cheese, tofu, nuts, and nut butters. Fats such as oils, avocado, olives, salad dressings, mayonnaise, butter, and margarines, and our non-starchy vegetables such as asparagus, broccoli, carrots, cauliflower, cucumbers, green beans, onions, peppers, tomatoes, zucchinis, and many others. So when planning your meals and your snacks, you do want to make sure that you are choosing these complex carbs that have fiber in them and are rich in nutrients. Now, one thing you'll want to try to avoid during this time are more refined products. So one thing you'll notice with them on the label is that you can still utilize the total carbohydrate, but if you look at the dietary fiber, there's 0 grams of fiber. And that first ingredient says unbleached enriched flour. There's also 11 grams of sugar in this item. So an item like this has added sugar and it does not have fiber, which means it's going to turn to sugar a lot faster after you eat it, making your blood sugar rise faster. So some other items you're going to want to limit during this time would be cookies, pies, cakes, ice cream, candies, any other sweets like that, as well as sugary beverages such as soda, energy drinks, fruit juice, coffee drinks, sweet teas, anything else that might have sugar added to it. When you're putting your meals together, you do want to be consistent with the carbohydrate amount. A common serving of carbohydrate is a measurement of 15 grams. At a meal, 45 grams is an appropriate amount of carbohydrate to eat. Snacks, 15 to 30 grams. You can increase or decrease your intake of carbohydrate foods depending on your energy needs and how hungry you're feeling. The smaller amount that you eat at a meal, most likely you'll have to eat more often to meet your energy needs. A common serving of carbohydrate is 15 grams. It's important to know your foods and look at nutrition labels when available to figure out what 15 grams of carbohydrate looks like. So some simple examples, when we're just thinking of fruit, a 4-ounce piece of fruit is typically around 15 grams of carbohydrate, and you'll notice it just fits nicely in your hand. Another estimate for berries or grapes would just be what would fit nicely again in the palm of your hands there. You could also use a 1/2 cup to a cup measuring utensil to estimate that size as well. A typical slice of wheat bread is going to be about 1 ounce, which is 15 grams of carbohydrates. Then we have about 5 or 6 whole grain crackers, are also around 15 grams of carbohydrate. You're going to want to look at the list of foods that's provided on the Gestational Diabetes postcard that was provided to you from your main healthcare provider. It's going to list out all of our food groups and those carbohydrate amounts and what the appropriate serving size would be. So we're going to look at cereal. Now, cereal is one where it's easy to get too many carbohydrates. First, you want to make sure that you're choosing a whole grain cereal so you're getting fiber in that meal. So I'm going to just take a 1 cup measuring utensil and I'm going to scoop out a cup of cereal. Now, most cereal bowls can probably hold up to 3 cups of cereal. That's way too many carbohydrates. So I'm going to show you what 1 cup of cereal is going to look like in a bowl. So that might be less than you would typically pour into your bowl. But if we look at the label, it says the serving size is 1.5 cups of these whole grain Cheerios. And that's going to provide 29 grams of carbohydrate. So where we have 1 cup of cereal here, that's going to be a little bit less than that 30 grams of carbohydrate. And then you have your milk added to that. So you're going to be staying under 45 grams of carbohydrate there. When you're looking for a whole grain, again, you'll want to find something that is 100% whole grain so you're getting good nutrients and fiber. This is an example of some whole grain pasta. You can get it in many shapes. One thing that you'll want to pay attention to with pasta is on the nutrition label, you'll often see this whole grain symbol. Many products will have this, and that is one good thing to look for to know that it's a whole grain item. You'll also want to make sure on the ingredient list that that first word there is whole. So this says whole grain durum wheat. If it's a white flour-based product, it's going to say enriched. Also on the label, under total carbohydrate, you're going to want to make sure there's a good amount of fiber there. You should look for at least 2 grams of fiber per 15 gram carbohydrate serving. On this pasta box, it is saying that 2 ounces of cooked noodles is a serving that provides 39 grams of carbohydrate. And you're getting 7 grams of dietary fiber. This is a great product to use. Now you can increase or decrease your serving size of your carbohydrate food to meet your carbohydrate goal at that meal. So if you want to bring in a slice of bread and a cup of milk to your dinner meal, you would want to reduce your serving of your pasta to keep it around your carbohydrate goal, such as that 45 grams of carbohydrate. When you're putting together your meals, you can picture your plate to be half vegetables, and the other half of your plate you quarter to your protein and your starch or your grain. So in this example, I have about a 1/2 cup of steamed broccoli, a 6-ounce sweet potato baked, and a 3-ounce chicken breast. Now, as I mentioned, if your meals are going to be more than 4 hours apart, it's a good idea to have a snack in there. You want your snack to also have something with carbohydrate energy and protein as well. So here we have about 6 ounces or 2/3 a cup of a plain yogurt. If you like the flavored yogurts, you're gonna wanna find one that is very low sugar. You can top that with some fresh berries to bring in some more fiber to that meal, and then the yogurt is bringing in some protein too. Now our lunch idea here, something simple such as a half of a turkey sandwich with some whole grain bread. We have some soup with beans and vegetables in there, and then we have about 15 grapes. This meal here is also around 45 grams of carbohydrate. An idea for an afternoon snack might be some whole grain crackers, an ounce of cheese, and some veggies. So again, we're bringing together a complex carbohydrate, a fiber-rich cracker, along with some protein from the cheese. So that will carry your blood sugars to be stable through the rest of the afternoon. In this dinner example, we have about 2/3 a cup to a cup of brown rice, 3 ounces of salmon, and about a cup of roasted vegetables here. And again, you could add a piece of fruit or about 8 ounces of milk to that to help meet your energy needs. Some of the main things that we talked about today was choosing complex carbohydrates that are nutrient rich and keeping a consistent, well-balanced eating pattern so your blood sugars are stable throughout the day. And don't forget to use that postcard that is going to list out the carbohydrate foods and their appropriate serving sizes. This will help you plan meals and put everything together. Also, pay attention to those nutrition labels to make sure you're making those nutrient-rich choices that have fiber. Thank you for taking the time today to learn about gestational diabetes and put your health and your baby's health a priority. If you feel that you need more assistance, if anything was confusing at all, or you need further guidance, we can give you some individualized care. We have a clinical nutrition service team and a diabetes educator at Tri-State Memorial Hospital who can further assist you. Please see the postcard provided to you from your healthcare provider with that contact information for that team. Don't stress, you'll do great, and we're here to help you. You've got this.